Hi, this is Dr. Michael Green. I am an OBGYN, Chief Medical Officer of Winona, and for many of you, your personal doctor. And I'd like to answer questions. And so today the question I'm going to answer is, can I take bioidentical hormone replacement therapy in my 30s? And the answer is yes. If you're having symptoms of the menopause transition, it's definitely okay to take hormone replacement therapy in your 30s. Now, this is kind of unusual for some people. I'm 35, I'm 38, I'm 39. How could I be going through the menopause transition? But honestly, it's not that uncommon. If you look at the statistics, about 15% of women will actually complete the menopause transition by age 45. They've gone through menopause at age 45, and we know symptoms start 7 to 10 years before the completion of the menopause transition. That transition can take 7 to 10 years. And so if you think of the idea that 15% of women have finished menopause by 45, and you count back 7 to 10 years, those 15% of women are having symptoms in their 30s. And we really want to start hormone replacement therapy when symptoms start for two reasons, really. First is make you feel better. I mean, why live with symptoms if you don't have to, right? And so it's really important to start the medicine, get your symptoms under control, and enjoy your life. It doesn't really matter what your actual age is. What matters is what's going on in your body and how do you feel. The other reason is that there are benefits of hormone replacement therapy beyond just symptom control. And those benefits start as soon as you start it. And so cardiovascular disease is probably the biggest one. And we know that estrogen is really important at preventing heart disease. We know that women before menopause have a much lower incidence of heart disease than men, but after menopause, they start catching up because of this drop in estrogen. And starting estrogen earlier helps protect your heart and keeps your risk of heart disease low. And so that's one of the benefits of starting hormone replacement therapy early when symptoms start. Osteoporosis is another one, loss of minerals in the bone. And we know that estrogen is very important for that. And so it's another benefit of starting hormone replacement therapy earlier is it'll protect your bones for longer. So symptom control is sort of the most important thing, and that's when we know, hey, it's time to start this. But there's other benefits sort of working behind the scenes as well. And so if you're that 15% of women that are getting symptoms of the menopause transition in your 30s, it's the right time to start hormone replacement therapy. And so again, the absolute age isn't so important as much as when are the symptoms starting. So 30s, mid to late 30s can be a very appropriate time to start hormone replacement therapy.